Do you think the American healthcare system is set up for your health, for prevention, or to treat diseases? And which one's more profitable? You guessed it. I spent less than 1 week in medical school learning about any sort of prevention strategies for mind, body, spirit. Less than 1 week. Why? There's no money in it. And it's a sad truth. There's no money in prevention. There is enormous money in treating diseases and giving death care. Hence the title of the book. Universal Death Care. But I want to bring a solution to you. So it's a solution for healthcare in the age of entitlement. See, we are in the age of entitlement, and we all know it. We think that we're entitled to health, regardless of if we're smoking 5 packs a day and eating 12 donuts every morning for breakfast and 300 pounds overweight. We think that you can come to the doctor and I'll just give you the pill and poof, you're going to be healthy. It doesn't work that way. What we have right now, from start to finish, from medical school to corporations to patient perspectives, it's universal death care in the age of entitlement. The book, it's a solution. It's a way forward. Is it perfect? No. But the point is that if you read it, if you're actually brave enough to think about the concepts in it and not just say, it's socialist, or it can't happen, or if you actually think about it, get educated yourself, and then engage in a dialogue with me, with the politicians, with whoever, your neighbor, doesn't matter. Engage in a conversation instead of name calling and obstinance. Then we, the citizens of this great country, we can change it for our generation and all generations to come. Why universal death care? Because I'm sick of it. So are you.
The title of the book is Universal Death Care, a Solution for Healthcare in the Age of Entitlement. That's quite a daunting title. What do you really mean by that?
Well, the United States has a private healthcare system until you get to be 65, and then it goes to Medicare, which is more of a quote-unquote socialized system. I don't think socialized is the right word, but for this conversation, that's what I'm going to use. And that care that is delivered results in the most number of bankruptcies of any category of bankruptcy. It results in horrible rationing of care because people simply can't afford it. Whether you have private insurance or not, you might have a $10,000 deductible plus pay $1,500 a month before your insurance even kicks in. And so people don't go to the doctor, they don't do preventative medicine, they don't do all the things they need to do to stay healthy. And then you have a whole system that is based upon treating disease, because disease is enormously profitable. From medical schools that spend an enormous amount of time teaching pharmacy and nothing about teaching diet and exercise and mental and spiritual health. Whether you're talking about pharmaceutical companies that just jack up the prices every year because what's the public going to do? Are they going to not take the medicine? They're going to die? So they keep jacking them up. From corporations who are in the quote-unquote healthcare industry to help with health, they're not about that. They're about doing the bottom line. Every part of our system, from start to finish, is focusing on death care, on disease care. And the patients. Look at our country. We are the most obese nation in the world. And that obesity leads to horrible outcomes and extremely expensive care. And so what they are doing is they're not focusing on prevention. They're not focusing on health care. They're focusing on, I'm just going to abuse my body until I need a lot of disease care. And so I named this universal death care because, in my opinion, that's what we have in this country. It's care that's focused on disease. The entire industry, from patient to the doctor and everything in between, is focused on disease. And that is not sustainable. It's not sustainable from a perspective of living to your potential, because we all know if you don't have health, you don't have anything. You could be a billionaire and bedridden, can't get out of bed, and what is that money going to do for you? So from an individual perspective or potential, from a societal perspective or potential, we are not living up to what we could be. And we're doing that because we're entitled. We all think that we're due health and vitality and a long life, no matter what we do. No matter if we smoke, if we're obese, if we haven't exercised in 5 years, fill in the blank. And so the system that we have in America right now is universal death care in the age of entitlement. Now this book is a solution too. And the primary solution too is to become educated. Know where we stand as a country on healthcare. Know where you stand as a person, as a patient with your own health. Become educated on the issues and then vote and hold your politicians accountable so that we can get to a state that works better for everyone.